Welcome, everyone. Thank you for joining us. We are here to hear from Massachusetts Public Health Association's Carlene Pavlos and Jeneczka Roman. They will introduce themselves in just a minute. This conversation is about Vaccine Equity Now, a campaign that the association is putting forth, looking for 10,000 signatures in 10 days, less than 10 days now, to really make sure that that equity for vaccines for COVID-19 can really be as robust and equitable as possible. I'm grateful for my colleagues Carlene and Jeneczka joining us. They will give a presentation. This is a recorded conversation, and there'll be an opportunity for questions and answers after the presentation. You can put those in the chat and we can go from there. So without further ado, Carlene, Jeneczka, the floor is yours.
Thank you, Craig. We really appreciate the invitation to be here with all of you today. And before I go any further, I also want to give a shout out to Corinne Malarkey, who is an intern working with MPHA right now. So thanks for being here. It's great to see you. And interrupt with your thoughts and ideas, Corinne. It'll be great to have you on with us today. So hi, everybody. I'm Carlene Pavlos. I'm the Executive Director of the Massachusetts Public Health Association. And I'm going to tell you a little bit more about MPHA in just a minute. But first, I want my colleague, Jeneczka Roman, to also introduce herself.
Hi, everyone. Thank you for welcoming us into this space to talk more about our work at MPHA and with the Vaccine Equity Now Coalition. It's so great to be here with you all.
It is. It's really great to have all of you here today. So I'm going to start and just give you a little bit of a grounding in MPHA and what we do, and talk a little bit about the work that we've done during this pandemic. And then I'm going to hand it over to Jeneczka, who's going to talk specifically about our work most recently with the Vaccine Equity Now Coalition. So MPHA is the statewide public health association, and we're a little bit different, I think, than a lot of if you're familiar with the American Public Health Association and their affiliates, we're a little bit different than a lot of those affiliates are, because our real focus is on statewide policy. We do advocacy and a lot of organizing to pass policy at the state level. And what we focus on is really, our tagline is Action for Health Equity. We're an organization that is really focused on promoting communities to create greater health equity with leading with anti-racism, actually, framework in our work, recognizing that oppression is intersectional, but really using a leading with racism approach in our work. We have a very active board, and one of our board members probably pretty well. Craig Andrade is one of our board members. We have a really active board and a racial equity and health committee of the board. We also have an active, what we call a policy council, and our policy council is responsible for helping us identify and prioritize our policy agenda, our legislative agenda in particular, using a real health equity framework as we identify those policies that those policies that MPHA is going to focus on. So that's a little bit about us and the work that we've done for many years. Last year, like almost now, right, almost exactly a year ago, our work pivoted pretty dramatically because of COVID. And in the very earliest days of the pandemic, we predicted that the pandemic would follow what are typical patterns of racism, poverty, and xenophobia in the way in which the pandemic would impact this state. And so we reached out to organizations, allies that we work with, to say, do you think that we should be doing some work right now quickly to make certain that equity is thought about as the state begins to ramp up its response to coronavirus? And yes was the answer. And so we convened this, what we then called the Emergency Task Force on Coronavirus and Equity. And that task force continues to meet. Jeneczka actually is one of the key reasons that the task force continues to meet. She leads a lot of our work in that area. And it has grown to more than 100 organizational members. And the purpose of that task force is to focus on policy and really drive policy change. And so we're happy to talk more about it and answer more questions if people are interested in the work of the task force. But we are now working in a couple of particular areas. One is on equitable reopening, and that has really had a huge focus on the vaccine rollout. And so 3 to 4 weeks ago, we began working we began working with leaders from Black, Latinx, and immigrant led communities, from those communities and from organizations that work in those communities and are led by Black, Latinx, and immigrant leaders, to again look at this question of the vaccine rollout and say, are other people seeing the inequities that we're seeing, and should we come together and make and push for change? And again, there was a real agreement that there was a critical need to do that. And so I should say, by the way, I identify as white, and our policy director, who isn't here today, is also white, a white man named Maddie Ribble, who does amazing work with us. And so because of the white leadership in the policy space at MPHA, we are in this with the Vaccine Equity Now Coalition, which is this nascent group that has come together to work on these issues that, again, Jeneczka will be talking more about. MPHA's role has been a lot of facilitating in the background, coordinating meetings, and really following the lead of the Black, Latinx, and immigrant leaders on this coalition. So we continue to that is the space that we're trying to occupy with the coalition, and are just completely honored to be part of the Vaccine Equity Now work that's happening, and of the really urgent and critical 5 demands that you're going to be learning more about from Jeneczka. So I think that's all I really need to say, or maybe more than I needed to say. And Jeneczka will take it from here, and then again, we'll answer questions towards the end.
Awesome. Thank you so much, Carlene. So I'm just going to share my screen quickly to present on the work of the coalition. So I just wanted to quickly start off with an explanation of what we mean when we say vaccine equity. So an equitable distribution of vaccines in the state must take into account the disproportionate impact of COVID-19 and prioritize Black, Latinx, and immigrant communities that have faced a greater burden of COVID infections, serious illness, and economic suffering, right? So this requires an understanding that the historic and current racism in our medical and public health systems, and acknowledging openly and publicly that there's earned distrust in communities of color. And unless we deal with this directly and intentionally, an equitable distribution of vaccine will not be possible. So to quote Senator Sonia Chang Diaz, this past year has been a textbook case study on structural racism. We've witnessed it play out in cases and serious illness and death due to COVID. Advocates have been calling on Governor Baker to strategically and comprehensively address the stark racial inequities as part of the state's vaccine rollout. But as you can see, and what the data shows, equity still remains absent from the state's plan. So this chart depicts the cumulative impacts of COVID-19 by race and ethnicity. And a quick shout out to Corinne for doing all our data work and creating this chart for us. So the 1.0 represents the rate per 100,000 of the population of cases, hospitalizations, and vaccines for white residents. So if the impacts of COVID and vaccines were all equitably distributed amongst all racial ethnic groups, all groups would be exactly at 1.0. But in reality, we're seeing that while Black and Latinx residents have experienced 1.6 times and 3.3 times the rate of hospitalizations when compared to whites, their rates of vaccinations are less than 80% than that of white residents. And I also quickly want to note and draw your attention to the Asian population in the state. And while it's very diverse, the cumulative and aggregate data from DPH likely hides inequities facing some of the Asian population in the Commonwealth. So I just wanted to quickly note that. So because of these stark inequities, a group of civil rights, racial justice, immigrant rights, and public health leaders came together on February 3rd and agreed that urgent action was necessary, because it's no exaggeration to say that lives are being lost every single day that these inequities continue. So these 11 organizations came together and released a set of 5 demands. The first of which is to direct $10 million to local trusted community organizations for outreach and engagement, to immediately implement the promised 20% additional doses for communities most impacted, to set benchmarks that mirror the disproportionate impact on Black and Latinx communities, to improve language access and cultural humility in the vaccine outreach and administration, and to appoint a vaccine czar with authority and accountability to address these inequities. So these demands build on general principles needed to address structural racism and health inequities, principles that are not being met by the current rollout and are not existent in other parts of the COVID response, right? So we want to see direct investment in communities and infrastructure, in capacity, and in resiliency, because we know that community-centered responses are the ones that are most sustainable and successful if we're trying to address inequities and disparities. And the state must come up with ways to develop more authentic partnerships with community and to also fund their boots on the ground work. We also need to do more to listen to the voices of people who are most impacted by racism, xenophobia, and other forms of oppression when developing solutions to address these inequities. Because when those in power design the solutions, they are at best destined to treat the symptoms and not the causes. And we literally can't afford such downstream solutions because they're extremely costly and they need to be repeated again and again and again. And even more unethically, they cost lives. And lastly, we need to addressing inequity requires benchmarks. So you can't claim to center equity unless there are clear goals to measure progress. And these benchmarks must be followed by effective data collection and transparency in reporting the data, both in the analyzed form and the de-identified raw form. Because without benchmarks and transparency, verbal commitments made by the administration only serve to placate and ultimately ring hollow. And we, the public, the coalition, we want more than words. We want the administration to take immediate action. So we know that the Baker administration responds to public pressure. So since the launch of the coalition and the 5 demands, we initiated a push to get over 10,000 signatures on a petition to deliver to Governor Baker. So we're here today to ask for all of your help in reaching that goal. And there are 3 ways to take action. We invite every individual or organization to sign on to this petition. It's available both in Spanish and in English, and we're working to have it translated into other languages. You've signed on, awesome, thank you so much. Please send it out in an email blast to your friends, your family, your colleagues, and your networks. We have a customizable template email that folks can share. And for all social media users, we have a template and a toolkit that you can use to activate your networks. So please help us in reaching this goal and making these demands a reality. And I believe Emily or Carlene chatted out the links in the chat for folks to take action. So thank you all.
Jeneczka, Carlene, thank you so much. That I can't say enough of how grateful I am for you bringing this here. For all of you SBH colleagues, community members, this is deliberate in terms of the Activist Lab bringing this forward at this time. Over the last several months during COVID, 9 or 10 months during COVID, we've had these conversations around social justice, racial equity, health equity, and bold, brave public health practice that meets the world as it is. The Mass Public Health Association is that bold, brave public health practitioner that I wanted to have be the first inaugural conversation around how you as students can engage and find ways to support the change that we mean to have. And so what you see here is them in action, asking you to take action to make sure that the equity that we all believe in is manifested here in Massachusetts in a way that the rest of the nation can watch and see. So questions, anyone? You can put them in the chat.
Mute yourself.
I have this is a question from Allegra Gordon. Are there examples of states or jurisdictions or other countries that you know that are doing a good job of implementing vaccine rollout with equity principles in mind?
So, Jeneczka, do you want to start, or do you want me? I'm fine doing it either way.
You can go for it, Carlene, then I'll fill in.
All right. So to me, this is complicated. Allegra, thank you for the question. It's complicated because early on well, maybe not that early, not early enough actually, but late last fall in November, the Department of Public Health, so our state's Department of Public Health, convened a group of a really good group of experts to advise them on the vaccine rollout. And that group put together, to advise them on the vaccine plan, actually, to advise them on the vaccine plan. And that group came up with a plan that at least we at MPHA complemented. It had equity built into the plan in a lot of different ways. They thought about they had principles, both of protecting the health system, like trying to think about that because that is, important in the COVID pandemic, as well as on reaching hardest hit populations, and phased the plan. They built into it a commitment to 20% additional allocation for hardest hit communities. And the people who were on that advisory board were really some people who really do represent communities that are hardest hit. So they were listening to experts, right? People close to the pain, right? The issue has been since then, so they came out with a plan, that was in November, they submitted it to the feds, and then no operations plan. It's as if like they were like, yay. And now we're gonna, I don't know, hope for the best when we get vaccine, we'll just, and it's so there's a mix of having a strategy and a plan in place and having an operations tactical plan in place. And those two have not, there's really not been a good syncing of those in Massachusetts. And that is, you see that repeated, at least I feel like we're seeing that repeated in a lot of places. And I'll give you a couple examples about that. So most recently, the state has talked about having an equity initiative where they're going to give $4.7 million to focus on 20 communities that they've identified as highest risk. And again, they used some good, we think, some good variables for identifying highest risk, the impact in that community of COVID, the CDC Social Vulnerability Index, and the percentage of people of color living in those communities. But is the $4.7 million going to organizations in those communities? Not apparently. Apparently it's going to 2 statewide organizations so that they can hire door knockers and liaisons. It's like, what? So there are a lot of words where you see people making promises, but then the follow through. And the reason I'm bringing all of this up now is so it's hard to assess from afar, right? Like we can, Rhode Island has done some work in prioritizing hardest hit communities. And for example, in Providence, they have allowed those communities in Providence that have the highest rates to expand eligibility for vaccination down to 50, the age of 50, because recognizing that life expectancy in those communities probably may not reach 75 or may not reach 65, let alone 75. And there's health inequity already experienced in those communities, so much more likely to be complicating conditions, right, at younger ages. So that is great. It's great. And people accessing those vaccination slots continue to vastly overrepresent white suburban people who are then going into those communities and those vaccination sites to get the vaccine. And we see that happen here. So for example, the state just said that teachers can sign up. We're certain that it is going to replicate the patterns that have already existed in teachers in Wellesley and teachers in, the suburbs. For those of you who aren't from this area, Wellesley is a very well-to-do suburb of Boston. Those who are in communities and who are people of privilege are going to have more access than teachers who work in hardest hit communities and are from hardest hit communities, right? Because they don't have practices in place that create greater access. Eligibility and access are becoming 2 different terms, right? We think we're creating access by creating eligibility, and that is just not the case. So it's hard to see from afar it's hard to name that in other states. I would hesitate to do that in some ways, because I think some people would look at Massachusetts and say, oh, there's like equity built in. We can see how that works. It's the on the ground operations and reality where we're seeing the disconnect. Jeneczka, I don't know, you probably have other insights to add to that.
No, Carlene, I completely agree. I think you hit the nail on the head. And I just want to also point out that there are some states, like for example, Connecticut, that they built in equity measures into their rollout plan. And then in an effort to speed up the distribution, scaled that back without any warning and moved to an age-based approach, which does not center equity. And like Carlene said, eligibility and access are 2 different things, right? So that ensures that people with privilege continue to get vaccinated at higher rates in the hardest hit communities. And I think that's something that we want to avoid in this state, and want to continue pushing on the governor to take action on these demands so that communities that have been greatest impacted by COVID have access.
That is,
Thank you.
can I just add on to what Jeneczka was just saying? The accountability measures are such a critical point. In Massachusetts, we don't have benchmarks. The state has not established benchmarks for equity. So it's also really, there's a complete disconnect there with claims about equity. And I think, and that's why it's such a central demand of the Vaccine Equity Now Coalition. And something that it will be really, really important to see how that rolls out. Jeneczka earlier quoted a state senator, Sonia Chang Diaz, who is from the Boston area. And I'm going to quote her again, probably not exactly, but in content. She, at the launch of the Vaccine Equity Now Coalition and the release of the demands, she talked about how vaccine eligibility is really creating a raffle, not even a lottery, but a raffle, because a lottery presupposes that everybody has a chance, like there's an open lottery, but with a raffle, you're buying tickets, and how many tickets you can buy totally influences your chance of getting one of those slots. And if you can't sit on the phone or on the computer for hours, if you don't have an internet connection, if you don't have the time because you can't afford the income loss that's sitting on a computer and waiting until slots open, that you can't afford the income loss or don't have a car to drive to a mass vaccination site, all of those things mean that you might have a single ticket through your eligibility, but you don't have the ability to purchase all of the tickets that actually create the real access. So it's a huge inequity, and and it's just another way of talking about analogizing the importance of having the detailed plans that create equity, not just a commitment. Our world is structured right now, right, in a way where systemic racism and other forms of oppression are built in. And if we don't actively plan to address those in a very strategic and then operations way, we don't get the equity that we, think is just gonna happen.
Rika brings another question here for you both. Rika says, do you have any plans to address issues that undocumented immigrants are facing? I have noticed that while the Mass Department of Public Health provide vaccines to undocumented immigrants and will not require IDs or social security numbers, medical documentation. However, it is up to each vaccination site with what documents they require for vaccination. The current rollout makes it nearly impossible for undocumented immigrants to be vaccinated, despite what DPH has outlined. I think we need to request that Baker administration to implement a statewide policy of vaccination sites without requiring these documentations. So thoughts about that?
Yeah, sure. Thank you for that question. I think it definitely highlights the piecemeal approach that the state has taken and the lack of a comprehensive strategic plan for implementing the rollout. So we know that in the state's plan, they've really emphasized the need for having a car to be able to access any of the vaccination sites. Or even testing, and that impacts those without status who don't have cars or don't have a driver's license, and it presents a risk to those who have to drive that far without a license. So we are working with different partner organizations on like multi-prong approach. So there are currently certain policies like the Work and Family Mobility Act, if passed, would help ensure safety for residents without status to get a valid ID in the state. And additionally, I think that highlights the need to really partner with local trusted community organizations and create creative interventions within community instead of having folks travel miles and miles, sometimes hours, to access a vaccination site. So I think that's one strategy that we're hoping to implement in different communities, because it's not a one size fits all. Every community knows and has the framework and structure on how to best engage residents in their community. So holding up, I think, success stories and having that be a model to other community members, I think will be really important as well. But Carlene, is there anything that you'd like to add?
So I'm thinking about two things. One of the lead partners in the Vaccine Equity Now Coalition, one of the co-chairs, is the Massachusetts Immigrant and Refugee Advocacy Coalition, MPHA Coalition. So they are definitely helping us think about this. And we have a number of other immigrant serving organizations are part of the coalition, which is, I think, given us some given the coalition some expertise. Experience to be thinking about this. There are two things just to make sure that everybody knows. One is that there is no cost to the vaccine. Most sites are asking for insurance information if people have insurance, because they would prefer insurers pay for it and that's not a bad strategy, right? Because we should have insurers paying for something rather than public resources paying for something if we can get insurance coverage. And it's a very complicated thing though, because just asking for insurance information can be a deterrent for a person who doesn't have documentation, right? And one of the things I'm noticing in the question that you asked, Rinka, is I wonder if you have some direct information that might be helpful for us in responding to, like it appears like you may know that people are being asked for this particular information in certain sites. I'd be interested in learning more about what you know about that, because there may be things that then we could think about to directly address. We have early in the pandemic, we did some work with the Attorney General's office so that I don't know if people know, Maura Healey, our state attorney general, has been a real ally around immigrant rights, and her office did some good work in publicly messaging around access for immigrants, including those with documentation and without documentation, that should not be a barrier. And so if there are examples like that, we could maybe, again, be working with her office to do some additional messaging about that, because you're right, this shouldn't be happening. And I'm about to say something that maybe I shouldn't in this venue, but I'm going to. It's less effective to work with the Baker administration than it is to work with the Attorney General on things like this.
Gotcha. Thank you so much for responding to my question. Yeah, it comes from my personal experience where when I was vaccinated, I looked online and the MDPH said they didn't need all these things, and I brought them just in case. And then I was asked to present everything. And after that, I came home and looked up other vaccination sites to see if they're requiring IDs anything else, and they are. And I mean, you know, this applies to undocumented immigrants as well, but also even just vulnerable populations who might have a
Absolutely.
medical condition but not have the documentation necessary. So I was just thinking along those lines, but thank you for your insight.
Yeah, and there is no medical documentation that is supposed to be required of the conditions. There's attestation, but no documentation that's supposed to be required of the medical conditions. Now that has some problems with it for people who are not truthful, but the idea behind that is to create more access.
So I want to just there's a couple other questions I want to share, but I want to reiterate the hope is that in this first engagement with students around advocacy and activism, this first new engagement, and I should say the first, what I hope was of many opportunities for students to gain directly in ways to be able to advocate and be activists in all different kinds of ways. And we mean, as the Activist Lab, to really sponsor those and point directions so you can lead and decide the right strategies moving forward. Here, we're asking in particular for you to share with your peers the information that was shared in the PowerPoint, and we have the link that's in the chat, to amplify this important need that has been explained through this conversation, sharing it as broadly and widely. My understanding is that we, through Sam Burkhart's support, have had a forum of students, not just from the School of Public Health, but from Harvard and Northeastern. Is that correct, Sam? And other student groups are all throughout this, including the Student Senate. So encourage you to do that and spread the word as broadly as possible. This is our first chance to really help this state in particular model what is the way to practice public health in this crisis that we're in. I'm going to combine these two questions, one from Sam and one from Kenya. What are the next steps that the coalition, for the coalition after the petition ends, and how can students get involved? Kenya says, how can be a volunteer to help with these policies and initiatives?
Thank you for your questions. So right now, the coalition is still thinking through how best to deliver the petition, the letter to the governor. But the plan is to compile all of the signatures and publicly deliver the demands to Governor Baker sometime next week. We are hoping to align the delivery with the timing of the next Oversight Committee hearing, which was anticipated to be 2 weeks from the first Oversight Committee hearing, which would bring us to next Thursday. But we're still waiting to hear when that committee hearing will be. But we will likely do a public release and delivery to Governor Baker and earlier mid next week, most likely.
And I just can't help but add that I'm so thrilled that that you're paying attention to this issue of vaccine equity. And as Jeneczka said, literally lives are at stake in real time. Like, it's one of those things where so often in public health we talk about, you know, upstream and there are down the road implications. This is like it's creating additional sickness and death in real time to have the kind of inequitable rollout we have right now. And so your help is both appreciated and it's urgent. And MPHA has, have we released? We definitely have our legislative agenda for this session. In Massachusetts, there are, the legislative session is 2 years and it begins, it began in January, sort of. Things are a little bit delayed because of COVID, but it's a 2-year session, 2021 through 2022. And we have recently released our legislative priorities. If you are not on MPHA's email list, I am gonna send I'm going to give you my email, but also another person on staff's email. And if you want to be part of get on our constant contact email list to get updates about what we're doing, please do so, because there are times during this whole next year where we are going to be working on other critical issues, things like getting emergency paid sick time, things like housing stability, things like progressive revenue, so that people who make more pay their fair share of taxes in Massachusetts. So we work on a broad array of public policy issues. And if you're interested in that kind of work that is both connected to COVID and goes beyond the COVID pandemic, please join our email list, and you will be part of action alerts, both information that we send out routinely as well as action alerts. So I'll put my email and a couple of email addresses here for you to connect with.
Thank you, Carlene. Hiba has another question, and she thanks you all for the work and for presenting this today. Is the Mass Public Health Association working to establish clearer communication around vaccine rollout, identifying best avenues for communication, how to frame messaging, etc.? Many residents feel unsure of how to access the vaccine, even when they are eligible, which we know disproportionately impacts communities who can't access as many raffle tickets as they'd like.
Thank you, Hiba, for your question. Yes, as one of our 5 demands includes directing 10 million to local trusted community organizations for outreach and engagement, exactly for this purpose, because every community is an expert on like the needs of their community and how to best connect and reach folks, right? So what works in one community might not work in another. So we're really hoping that the administration will invest this money to help communities who already have materials and campaigns within their community to help disseminate it further and build out that structure and help to reach people. And as Carlene mentioned, the state did release recently that they will be investing 4.7 million for outreach and engagement in the hardest hit communities. And we're still trying to figure out how that fits into our demand and how much of that funding will go directly to local organizations. But yeah, that's a great question. And Carlene, is there anything else that you'd like to add?
No, that's, yeah. That's what I would have said too. We talk about these things a lot. So yeah, yeah, that's awesome.
I'm just gonna read what Emily Barbos says. As a student of advocacy and communication and a communication nerd, I am fascinated by the awareness campaign in general and the power of the petition in particular. Why 10,000? Is there a precedence, other successful MPH campaigns that were used to create this one?
No. That is not the answer I bet you were hoping for. It's not really the answer I should give, but it's true. So no, we were again, this was not just MPHA that developed this. We were talking with the steering committee of this nascent coalition, and we were just like, we've got to get 10,000 signatures in the last 10 days. I mean, in the next 10 days, because we've got it. This is urgent, so it's got to happen quick, and it's got to be a lot, because the only thing that we have learned that this administration responds to is public pressure. I will just emphasize that a little bit. Like, a lot of times when you're trying to think about how to move policy, we think about, like, we've got to get them the right data. We have to get them good information. We have to put together a fact sheet, because the more they know, the more they'll understand and they'll act. That is just not proven to be effective with this administration during COVID. Public pressure, really visible, like the optics of complaining, and of um, naming that this rollout hasn't been well managed, seem to be the only thing that gets action. Now, I will say the problem with our strategy, in all transparency, the problem with our strategy is twofold. One is it's big. It's like we might not be able to do it. So there's that. The other problem is that we haven't been able to figure out a strategy that will actually convince this administration that they need a comprehensive response rather than a piecemeal response. And so what we've been seeing over and over again, I describe it as like a fire drill response, where like a fire erupts, and so the whole administration turns their entire fire hose over there and like sprays it. And while they're doing that, the embers that are over here erupt in the next flames. And so they turn around, start spraying over there, and it happens again. And these fires keep erupting. And there isn't a comprehensive strategy to manage an effective vaccination plan. And we have figured out how to get their attention, but we haven't yet. I don't think, Jeneczka, you may have a different perspective on this, but I don't think that we have yet seen, either in the coalition, Vaccine Equity Now coalition, for our health equity task force, or from other advocates, a method that has helped this administration think, oh, we should have a comprehensive plan. That hasn't happened yet.
Yeah, no, I completely agree. I think that that's been the experience of many coalitions throughout the state, and we're all trying to work together and navigate and figure out what is actually going to be most impactful in moving the governor. I think because our tactics and our language were more aggressive through this coalition, and in the framing of our recommendations, that did generate more attention and did influence some of the questions that the governor has been receiving from legislators, and from like other coalitions across the state, right? So I think that's been successful, but we're still trying to figure out like what will actually make the governor move. And that's been a little bit of a trial and error, but we're learning and growing every day.
I'm going to read a couple things, and I want to give everybody a heads up. We're running short on time, so please don't hesitate to put a question in the chat for anything. I want to raise a couple things that have been said. Shafi offers some information. Depending on the vaccine, some basic information needed prior to administering a COVID-19 vaccine are past allergic reaction to vaccine or specific ingredients of vaccine, recent vaccine bleeding disorders, or recent TB tests. Insurance information may be applied for administration costs on not specifically the vaccine, which is provided free to the organization. One example is CVS Health. I hope this helps. I'm going to keep on going. Quickly, Sarah asks to clarify, are you looking for specifically for signatures from Mass residents, or can we distribute this to other networks out of state? And Carlene responded by saying, this is a great question. We are primarily seeking Mass residents.
Mm-hmm.
Sam has said, for students, one thing that's been working is doing quick announcements at the start of classes talking about Vaccine Equity Now campaign and sharing the petition. Professors have been very open to this if you ask them ahead of time. Great idea, Sam. So I want to just give a little bit of an origin story here that brought us here. So it's worth mentioning that Carlene used to be my boss. She was the bureau director of the Bureau of Community Health and Prevention. She was a bold, brave public health practitioner then. She was one of the founding members of a racial equity um, um, initiative in the Department of Public Health, the first bureau to start it. She encouraged me to become a bureau director. I became the bureau director for the Bureau of Family Health and Nutrition. We were sister bureaus, and we both then embraced the racial equity work that within almost just as I was leaving was starting to catch fire, and we created this cross department racial equity initiative. And so the commissioner committed it to the department, and it got to other agencies. Carlene left and became the executive director for Mass Public Health Association, bringing her bold, brave practice. She, with the staff, have created the most diverse board of directors that I've seen in a lot of different places. And as you've heard her and Jeneczka describe, they have been partnering in authentic ways across the state with leaders of color and agencies all over different topic areas, and leading with advocacy and activism with the foundation of all the things that you're learning at the School of Public Health, bringing the science, the head and the heart together to make these changes. And now this extension reaching out to you to do the same thing is a wonderful example of how we can continue to kind of make the change that we want to see in the world. So I'm grateful for all of you joining this conversation, and want to give you one more chance before we finish to ask any particular question that you might have.
Hiba has a really great, important question. What's the deadline for signatures for your petition?
And I was wondering what Jeneczka thought about that.
And I actually just put it in the chat. We'll be collecting signatures through next week. So thank you all for folks that have been sharing it with your classrooms and your networks. We appreciate it, and we'll be continuing to amplify on our social media and our newsletters. And we'll be sharing out next steps on the petition and the delivery to Governor Baker soon as well.
Other questions? Let me put in a plug for Your Power. This is the first engagement that we're coming directly to students, bypassing leadership and all that other kind of stuff. You're the leaders we want to talk to. And we want to hear more ideas of how we can engage your power to make the change, not just in metropolitan Boston, not just in Massachusetts, across the country and across the world. How can we engage you as strong public health superheroes, as strong public health practitioners with all the skills that you came to this school with and that you're gathering and collecting as you continue to go through the program? What can we do to engage your power to make the change globally, nationally, and locally? We soon want to find a way to go directly to you to get your leadership capacity, to think strategically with you. Where are the places we should be focusing? How can we marshal not just BU School of Public Health, but every school of public health here in Massachusetts, maybe even going abroad in all kinds of different directions? What can we do? We could call it the Justice League. We can call it all kinds of different things. We haven't thought of a name, but what do we do to start engaging what powers you have and the passion that you bring and all the knowledge and insight that you have? So keep that in mind. Reach out to me, reach out to the Activist Lab email address. If you could put that in the chat, Emily, that'd be great. Any final last questions in the 5 minutes that we have for anybody here? Any final comments, Carlene or Jeneczka?
Just thank you.
Mhm.
Sorry, go ahead.
Yeah, I agree. Thank you all for welcoming us into this space. And I wanted to quickly add, and I should have mentioned this earlier, equity is multidimensional, right? And a lot of concerns that intersect with race aren't being, that, for example, folks with disabilities or folks that are populations that are decarcerated are not explicitly represented in the demands. So we are working with leaders of the disability community and leaders who are leading campaigns on decarceration and improving health and safety for populations that are in prisons and jails to help amplify each other's demands and align ourselves to continue to put pressure on the governor and have a more intersectional approach. So I just wanted to also put that out there, that we are engaging other communities as well to strengthen these demands across the board for all populations in the state.
You're getting just a whole string of thank yous and applause. And when COVID goes by and we have you in live, we can throw roses at you and all kinds of other things. But for now, you all can put claps in the. There we go.
Gotcha.
Snaps and all that kind of stuff. Thank you all very much for joining us and making the time for this. We will amplify this all over and circle back as need be to kind of support the work of the Mass Public Health Association. We're really grateful for all you all do. Thank you all.